Now that we've evaluated the long head of the biceps tendon in long and short axis, we'll move on to our next anatomic structure, which is going to be the subscapularis. Now, in order to look at the subscapularis, primarily when the hand's in the neutral position, the subscapularis lies underneath the coracoid. In order to bring the subscapularis out for evaluation, we ask the patient to keep their elbow up against their side and then just do an external rotation and let their arm sit in external rotation. And it's nice to have something for the patient to rest their hand on, because this can be a hard position to hold into, which will bring the subscapularis out for our evaluation. Now we'll start our sonographic evaluation of the subscapularis tendon. So I'm going to place my transducer with the orientation marker pointed to the patient's anatomic right. The bone landmarks I'm going to look for are going to be the coracoid process medially, the humeral head and lesser tuberosity laterally. Placing the transducer with the orientation marker pointed to the patient's anatomic right. On the screen, I'm going to go find or locate the coracoid process medially, the humeral head, the anatomic neck, and the footprint for the subscapularis insertion. Once I see this image, concern rises from what is this hypoechoic area at the distal insertion point. If we look at the angle of the beam, the beam is coming straight down, but the anatomy is sloping away. So by moving my transducer to take care of the anisotropy, I can actually make the tendon fibers become bright, and I know that this is not an actual tear. Sliding my transducer back to medial now, keeping the tendon in the center of the screen, making sure that we have our depth adjusted to show the bone landmarks. I slide the transducer superiorly until the tendon completely disappears. Following that same motion, except moving the transducer inferiorly, slide the transducer inferior, and there's another important anatomic landmark that you can see on the lower left-hand side of the screen, which is the bicipital groove and the long head of the biceps tendon sitting in that bicipital groove. I know that that's out lateral, so this is going to be the subscapularis. Moving the transducer inferiorly, you'll notice that the tendon fibers become bright and dark and bright. This is because the subscapularis is not a single myotendinous junction. It can be anywhere up to 4 to 8 tendon groups with muscles associated. So it's not uncommon to see bright fibers interspaced with muscle as we move inferiorly all the way down to the lower aspect or inferior aspect of the subscapularis. Some of the fibers of the subscapularis actually attach onto the shaft of the humerus. Sliding the transducer back up, we can see the nice smooth bone surface. Now, I've evaluated the subscapularis completely in its long axis. I've taken care of the area of anisotropy by moving the transducer. Now, the next thing I need to do is look at the subscapularis in its short axis. Rotating the transducer clockwise or pointing the orientation marker towards the patient's head, I've now got an orthogonal plane of the subscapularis. In order to start my evaluation, I want to move the transducer all the way over medial till I see the all-important coracoid process, and now from that point, I'm going to be evaluating the subscapularis. Noting that the subscapularis follows the contour of the humeral head, I have to angle back towards the humeral head, and now I can see the bone structure of the humeral head, the subscapularis tendon, the bursa, and the deltoid muscle sitting superficial. As I follow or slowly move my transducer out laterally, I'm going to see that we'll see these really tight hyperechoic structures sitting inside the tendon. These are the tendinous slips from the multiple muscle groups. Do not mistake this for a tear. These are normal muscle interspersed with the tendon slips. As I move the transducer out laterally, I continue to its insertion onto the lesser tuberosity. And if I continue my lateral movement of the transducer, I run into the bicipital groove and I see the long head of the biceps tendon, which tells me that I have evaluated the subscapularis tendon completely in its short axis from the insertion to the myotendinous junction. Moving the transducer back, retracing my steps, adjusting for anisotropy as I move, all the way back out to the coracoid process.